Hi there, hope you're doing well. Welcome back to the channel. Today's video, we're going to talk about a very common complaint that I received here in the office. Is how we can use hair transplant surgery to correct scars from facelifts, from eyebrow lifts, and from facial cosmetic surgery in general. That applies also to trauma, but we're going to record a video on trauma later on specifically. But a lot of patients, maybe you or someone you know, have had or is going to have procedures for their face, as I said, facelifts or eyebrow surgeries, and those can cause scarring in the scalp. So this is an important topic, and hopefully it'll get you some of your questions answered. Welcome back. So today we're going to talk about how we can use hair transplant surgery to correct scars from procedures such as facelifts, eyebrow lifts, and all the other cosmetic surgeries that people do on their face. This is based on a lecture that I gave a couple weeks ago for the American Academy of Cosmetic Surgery. We had a cadaver workshop on the day before the main conference, and the theme of the workshop was actually facial procedures. So we did a lot of facelifts and eyebrow lifts on the cadaver. When I say we, I don't perform these procedures. My practice is all about hair, as you know by now, probably if you follow the channel. So, but it's important for me to know this. The more I know about these procedures, the more I can, talk to my patients about it, and they ask me questions. And so it was a great opportunity to actually address the cosmetic surgeons in the conference because, when they're doing these procedures, they produce scars on the hairline. We'll see some examples here, or sometimes scars up here. And the hair is kind of a secondary thought for them. They're mostly worried about, of course, creating a natural result, lifting the face, lifting the brows. But the scars sometimes can be a concern for a patient depending on how they heal, where they're located. So what I talked to them about in great detail on the conference was that if they're going to do these procedures, they can start planning around the hair a little bit more. And I even gave them some tips on how to position these incisions to better, help us so that we don't have to put so many grafts in these patients. Because of course, the face looks great, but what about the hair? You have the scars. A lot of these procedures, you actually end up losing the sideburns as well, as we'll see here. So anyway, it's just a good thing to kind of work together with the cosmetic surgeons that are doing these procedures out there. And one thing I say too is if you're in the process now of looking for these procedures for yourself, or if you know someone, it's better to have them done before and then do the hair restoration after they're done, at least 6 months, better a year later, so that the scars can mature. So in order to plan with your plastic surgeon or cosmetic surgeon, now do the facial surgeries first, and then we'll take care of any scarring at the end. All right? So here I have some examples of patients that we treated, so you know what we're talking about. So a lot of times when facelifts are done, there's a couple of different techniques, but one of the techniques, they do an incision here around the ear, and they go around the hairline here behind the ear as well. So you can see in this picture, this patient had actually a brow lift. It's hard to see, but you can kind of see the scar from the brow lift right here. She actually lost a little bit of hair from natural hair loss too. And so it opened up this triangular area here. And you can see the scar from the facelift comes around here, wraps around the ear, and goes in the back. So with the surgery, she ended up losing her sideburns. This is just an example here of one of the types of incisions that you can have with a facelift. So kind of wraps around the ear here and it goes towards the back, and sometimes scars right here on the back of the hairline too. So if the patient wants to pull the hair up, that scar can show, and so we can correct those. Another surgery that's commonly done by plastic surgeons is the eyebrow lift or forehead lift. There's a couple of different techniques. One is called the endoscopic eyebrow, where the surgeons make incisions, like one here, one here, one here, and one on each side, and from there they kind of undermine everything. So these incisions are smaller, but one of the things that we talked about is how to position the incision so that the hair can cover better. And a lot of the plastic surgeons there at the meeting, they're like, oh yeah, that's a good idea. I can do that and help out the patient. The other way of doing this is to make an incision either behind the hairline, like across here, or right in the hairline itself. And so with that incision, the surgeon will cut the whole entire scalp, and then he will undermine everything and pull the forehead and the brow up. So either way, it causes scarring. Now this patient here in this example, she had the one that cuts around but in front of the hairline. So you can see how the cut came around here and actually goes down here. You can see on the hair. The same thing on this side, it kind of comes around there. And then what happens is she lost some hair naturally after the procedure, so the scars became exposed. So now she came to me to help her correct these procedures, correct the scars. So we can do procedures for these scars with FUT or follicular unit transplant, or the strip surgery, or FUEs. Either way, the important thing is to get healthy, nice hair grafts. So either technique is fine depending on the patient and the amount of hair they have to move. And we do these procedures for men and women. It doesn't really matter because men are having a lot of facial procedures as well. So we do them, in both sexes, and patients present to us with these problems regardless of their gender. And so depending on the size of the surgery, sometimes I favor for a strip, sometimes I favor for an FUE, and of course the patient's preference plays a role there too. We also have to account that patients a lot of times will lose hair naturally, right? And so sometimes a scar that's not exposed at one point in the surgery, it will be exposed a few years later. So it's important for us to also treat the hair loss so the patient can stay stable. Here's just kind of a close-up. I don't know how well the camera can see, but these are grafts that have been placed into scars. So you can see there, we can place them, put them pretty close together. Scar tissue is not like healthy scalp tissue, so I cannot put the hairs as close together as I would otherwise. So sometimes it requires a second surgery for complete camouflage of the scar, but usually with one procedure we can get a pretty good job and make sure that the patient can hide these scars a lot better. So using those two patients that we talked about briefly here, I'm gonna do a little bit of a case study. So we start with the lady that had the facelift. So this is my pre-op planning for her. You can see here how, of course, the scar comes around here from her eyebrow surgery. So we're gonna lower her hairline a little bit, not much. She also lost some hair here from genetic hair loss. So we're gonna fill in those areas. You can see those triangular areas here of loss. She's still maintaining her temporal point, this anatomical area right here, the corner. So I'm gonna use it for my reference, but we need to rebuild her sideburns because she lost it all. So we're gonna do this. We're gonna come across here and fill in these corners, come across, and then it's gonna fill in the scar areas on her sideburns with transplants. This is our pictures right after the surgery was done, so you can see a little bit of the grafts here placed all over the place here, so all the way down and into the sideburns. Same thing here too. This is immediately after the surgery. After about 10 days or so, these are all healed up. The second case is the patient that had the coronal or the eyebrow lift surgery with the coronal incision. Coronal means the cut across here, okay? So not the endoscopic surgery. So you can see here again the pre-op pictures, the scar on her left side, the scar on her right side, and the loss behind it. This is a picture of the front. So her incision actually comes across all the way here, and you can kind of see very faintly the line that I drew is right on the scar, just a little bit in front of it. So it may be hard to pick out with the camera, but you can kind of see the line goes right there. And you can see how much hair she lost. There was a little area here. She had a little bit more trauma, so she lost a little bit more hair there, forms kind of a triangle inside. So anyway, we're gonna fill in all of this with transplants. Again, this is the pre-op plan, just marking the two sides. This is her right after the surgery was done, so you can kind of see the pre-op markings there. Actually, this picture was done right before we placed the hairs. I can see now that there's no grafts in there. So it was right after I made all the incisions before we placed the grafts. This is before and after of this patient, so you can see how, in one procedure we get pretty nice density even on scar tissue. You can, knowing that she had the scar, you can kind of see a little bit of it still, like right here. I think I have a picture of her sides. There you go. The right side here camouflaged pretty well, so you can see how we filled in this corner here and the scar, so it turned out pretty nice. The left side, you can still see a little bit of the scar right here in front of the hair. Much better because this component of the scar right here is completely hidden, right? It goes under the hair right there. But there's still a little noticeability. So she'll come back for us a second time much lower amount of hairs, of course, but she'll come back for us to fill that in. So there you have it. Just a little quick talk on what we can do if you have scars from facelifts or eyebrow surgery. You don't have to worry about camouflaging them or combing the hair just right to cover them. We can help you out. And just come talk to us. We'll give you a consultation for free. We'll tell you what we can do for you. These procedures are very safe. They're very easy to go through. And the recovery is very quickly, much quicker than what you had when you had the major procedures. Not a lot of bruising, nothing, not a lot of swelling, so pretty easy to go through. And if you're going to have these procedures and you're worried about the hair, talk to me as well, and I can kind of tell you what to discuss with your plastic surgeon or cosmetic surgeon in advance of the surgery so that we can prevent these or at least make some plans for the future, right? Sometimes there's no way to avoid putting the scars in certain places, but we can plan around and go that way, all right? So please like the video. It'll help us get it in front of more people. If you haven't signed up to the channel yet, subscribe. We would appreciate that. We're trying to put content all the time for you guys to enjoy and learn more about hair loss and what we can do today with modern hair restoration. Questions for us, just send us questions. Put us comments below so we can look at them too. And I'll see you next time. Take care.